Welcome back to the Autism Action Update. I'm Assemblyman Angelo Santa Barbara. I serve as chair of the New York State Assembly's Subcommittee on Autism and Spectrum Disorders. And this podcast is an update on some of the work that I'm doing in the State Assembly and an update on an Autism Action Plan that I created in the State Assembly to address issues for those families and individuals that live with the challenges of autism, but also all those with disabilities in New York State. So last podcast, we talked about a number of things. We talked about a new program that was launched through my Autism Action Plan that brought the state's first standardized autism disability identification cards made them a reality here, and to date, thousands and thousands of cards have been requested. Look back to my last podcast to get more information on how to get that card and how it could be a useful tool in a number of situations where communication might be an issue. Today, we are going to be talking about a pilot program that is looking to bring the state's first sensory-friendly emergency rooms to hospitals in our state. This, as I said, will be a pilot program I've been working on in partnership with Ellis Hospital right here in Schenectady. This program is something that stems from experiences, my own personal experiences, and also experiences that I've heard from members of the community. Emergency rooms are pretty chaotic places. If you've ever gone to an emergency room, you know exactly what I'm talking about. Now, bringing a child with autism or a loved one with autism through an emergency room can be quite challenging. It was pretty challenging. My son had to be there a few times. And it was a pretty challenging experience, and a lot of that is trying to get a good diagnosis, trying to find out what is the best medical care for that individual. But getting there can be challenging, it can be difficult, as I said, and hearing from a number of parents, from individuals that have experienced this same exact situation. I have come up with a program that actually can seek to address a lot of the sensory issues. And we talked about sensory issues during my last podcast. The sensory issues can be a number of things. It can be lighting, it can be sound, it can be anxiety, and a host of other issues that kids with autism, those affected by autism, can face, and related conditions. A number of other conditions where sensory overload can occur. And as I said, there's a lot of noises, a lot of sound, a lot of light, a lot of things happening in an emergency room. And this pilot program seeks to create a program where we can have emergency rooms that address sensory issues. And sensory rooms, quiet rooms, this is not something new. This is something we are starting to see more and more of in our community. I've seen a number of businesses, a number of places in my community that is starting to adapt this concept of having special days to address sensory needs. I know the Via Aquarium in the Rotterdam Mall has special days. Sporting events has special days. We just did an event with Siena Basketball where they addressed sensory issues, sensory needs, so that kids and families with autism could enjoy a day of basketball. So we're looking to get this program off the ground this year to fit up emergency rooms that are already in the hospital. So this wouldn't take anything away from the hospital. This would actually just expand the ability to serve more people in these emergency rooms. So there's a number of exam rooms available. This program seeks to make these rooms more sensory friendly. So we're talking about lowering the lighting, reducing the number of people that are in the room at one time. Sometimes little things can make a big difference for those with autism. Sometimes it's even speaking softly. Having certain lighting in the room can make a really big difference. Removing or lowering, reducing the noise levels, but also removing some of the beeps and sounds that we hear in an emergency room. Sometimes those types of noises can be easily removed, and it would not affect the treatment of the individual. And it's important to address these sensory needs because that's the way, that's how we're going to be able to serve this community a lot better when it comes to healthcare, delivering healthcare. There was a number of stats that came out that show how a person with autism is 30% more likely. A report that came out that talked about how a person with autism is 30% more likely to go to an emergency room, and 3.5 times more likely to be admitted once they're there into the hospital. And their stay can be 30 to 40% longer than other individuals that do not have a condition like autism or a related condition. So this program seeks to get those numbers down to where they should be, where if it is something similar to any other individual that would go in there for a medical purpose, we can get to that diagnosis much quicker by removing the barriers to communication. That's what this program is about. It's not just the physical parts of the emergency room. We're also talking about training, cross-training, so what I like to call autism response teams in our hospitals, where, again, it's using existing staff that are there, but being able to be cross-trained to respond to a patient, an individual with autism that comes in need of medical care, to be able to call on his team to work with the family, work with the individual, to find out what the sensory needs are, to find out whether it's related to the environment, feeding, or a number of other items, and to come up with individualized plans that can better serve this community. And I think it's beneficial to the community, certainly beneficial to the hospital, because they can get to where they need to be, which is find out what the medical issue is and how to best treat that. So we're looking to get this program off the ground this year. There's a number of issues that we talked about in my autism plan that actually work with this program. We talked about the autism training for first responders, which did include EMS personnel. So we can start to see how these programs, through my overall autism action plan for the state, actually start to work together with the autism disability ID card that can help with that communication. You can see how that can easily help in an emergency room. If there's an ambulance ride required, how that training will actually come in to serve this population now on the way to the hospital, and now in the hospital room setting itself, trying to find out how best to serve this community. Part of it is addressing the sensory needs. Now, one of the things that we didn't talk about yet, we talked about the training, talked about the physical changes to the emergency room, the exam rooms themselves, but also the sensory needs that could be what I like to call part of a sensory kit. So having things like the rubber bands that we talked about that my son uses to manage stressful situations, and a number of other items can be in that sensory kit that can be movable objects but can be available. And again, my son likes to use rubber bands. Others may like to use a number of other sensory items that could be included in this sensory kit. And what we're seeing is sensory kits more available. We're seeing police officers starting to carry sensory kits. We're starting to see these items available. There's no reason they shouldn't be available in our emergency rooms. And when we talk about managing stressful situations, managing anxiety, these items in this sensory kit can go a long way towards helping get through an emergency room setting. So I'm looking to partner with Ellis Hospital. As I said, I'm excited to see that this program is actually in discussion, something that could be a possibility later this year. What's nice about the pilot program is that hopefully we can show the data to reduce those stays that are 30 to 40% longer now in the hospital for those with autism and a number of related conditions. We're looking to get that down with better diagnosis, delivering the health care that's more quickly and efficiently. This program is something that can do it. So I ask you to stay tuned on this. There's more to come. This isn't just the next piece of my autism action plan, but there's much more to come. There is a number of other programs that we'll be talking about in the future here on the podcast. But for now, wanted to make sure that this information is available to those that want to learn about it. Again, the training that would go along with it, more information will be coming along on that, and also the sensory kits that we talked about. More information will be forthcoming on that. But for this podcast, we are going to end with a number of other items that I want to share, that being that April is Autism Awareness Month. So coming up, I want to just mention that in April I have several events. One of them is our annual Autism Action Day at Via Aquarium, which I mentioned just a short while ago. That's on Sunday, April 7th at 9:30 at the Via Aquarium in the town of Rotterdam at the Rotterdam Mall. We just talked about this, addressing sensory needs. This is an annual event that allows those with autism and their families to come in free of charge, to be able to enjoy a day of exploring the aquarium in a sensory-friendly environment, autism-friendly, sensory-friendly, and that is an annual event that has seen a record turnout each year. So we hope to have more families join us this year. It's a fun time. I think people really enjoy it, and there's a number of sensory. There'll be a quiet room actually available in the aquarium, and there'll be staff will have the special training, and there's a number of special accommodations that have been made to address the sensory issues that we're talking about, that we just talked about in this pilot program with Ellis Hospital here in Schenectady. Also, there'll be a special appearance by Curious George, and you may even see the man in the yellow hat. That will be sponsored by WMHT, so that's a little special edition this year. And my Autism Action Day is the second event. They're coming up Wednesday, April 10th from 9 to 2 in the well of the Legislative Office Building. This is our day, our annual day, where we bring legislators together with families, individuals, organizations, to talk about the challenges, talk about the legislation and the funding that can make a difference. This is our day to do that. We're going to have a very special guest speaker. His name is Milo, the robot. And this robot actually visited my office earlier this week. And what's special about Milo is it's a unique, first of its kind. What I like to call is an autism-friendly robot. It's a robot that's being used to help kids with autism with learning, social skills, and a number of other items in an educational setting and at home as well. Something that we will share on Autism Day. So we hope you can make it there to hear Milo and what he has to say. More to come on that as well in our future podcasts here. We'll be talking with, we may even be talking with Milo at some point. And I do want to mention, to stay up to date, if you want to sign up to receive my autism action alerts, visit my website, www.nyassembly.gov, under Assemblyman Angelo Santa Barbara. You can watch my autism action update weekly shows. You can visit my Times Union blog. Those links will be available on the website, or visit timesunion.com. And of course, right here at OSM Proctors, you can catch my OSM show and the Assembly Update show that talks about similar topics and a lot of the work that's happening through the subcommittee on autism spectrum disorders. So for now, I'm signing off. We'll see you in the next installment of my podcast, where we'll be talking about a new training center for those with disabilities that also could be a reality sometime later this year. Nearly 70% of the more than 1.1 million people with disabilities are unemployed in New York State. That's a staggering number. This partnership hopefully will begin to change that by creating a special employment center that will bring those with disabilities into a classroom setting and be able to train them on specific job skills that businesses are looking for. More to come. Join us right here again for my next podcast.